consultant Vitreo-Retinal Surgeon to be specific. Today I plan to share some information about a very important part of our eye, that is the macula. We celebrate the Macular Week every year from June 22nd to June 28th. So what is this macula and why is it so important? The macula is the centermost part of the retina of our eyes. And the retina functions like a film of a camera. It is here when we see an object, light rays come and hit the retina and the signals are then sent to the brain through which we are able to see an object. The macula of the retina is responsible for central, sharp vision and reading vision. There are a few diseases which can affect the macula and cause defective vision. Out of these, the two most important and commonly seen diseases are diabetic maculopathy and age-related macular degeneration. In diabetic maculopathy, it is generally seen in people who are diabetics. And here the blood vessels are damaged and they cause leaking and fluid under the macula, leading to defective vision. In age-related macular degeneration, which generally affects people who are above 55 years of age, it can be of the dry type or the wet type. In dry type, there is thinning of the retina and some yellow deposits under the retinal surface. In the wet type, there are abnormal vessels which grow underneath these retinal surface and cause leaking, which leads to drop in vision. The good thing is, we are able to treat and manage these diseases to a certain extent if they are diagnosed at the correct stage of the disease. So what are the symptoms that you may encounter if you have these macular problems? You can have a drop in vision, unable to read near vision, or you may see dark spots in the center of the field of your vision. Straight lines may become wavy. So when we see these problems, what are you supposed to do? How can you protect your macula? The first and foremost thing for you at that stage is to consult your eye doctor for an examination and to determine whether you have a macular problem or not. On your part, to stay healthy and for a fit macula, first and foremost, you have to follow a healthy and stable lifestyle. You have to have a healthy diet which involves lots of green and leafy vegetables with antioxidants to protect the macula. When going out in the sun or outdoors for a long period of time, wear sunglasses. If you are a smoker, quit smoking. Control your diabetes, control hypertension and cholesterol and all other risk factors which can cause damage to your macula. Stay safe and stay healthy. Thank you.